Here doing my second video recording on the Lutheran Outpatient Clinic, and I chose to do the second one specific to that site, the 2 to 3 questions that I had for her, where we have a professional conversation. And the topic of choice was mainly patient-centered care and how it affected her job and how she does her job. My first question was, how does she approach each patient to make sure they get the best care? And she kind of says she has an understanding of her vestibulocochlear, where her specialty is, but she approaches each patient like a new entire case, so that way she can focus on their goals and what they can achieve and recover from. So some patients are worse off than others. So she makes sure that she analyzes everything from where their injury starts, how old they are, to what it all affects, to make sure she can either A, get them back to where they were before their injury, which is always the ideal case, but not always possible, or B, back to a functional and pain-free. The main goal is reducing pain and getting everyday daily living back. But if she can take it even farther, she will try to and do what's best in her ability to do so. I remember she told me that there was apparently Medicaid doesn't really support them getting back to functional activity. So there was a guy that played softball, I believe it wasn't baseball, and he was still coming back because he still didn't have the ability to play like he wanted to. But the Medicaid realized that, hey, he is functional, so she kind of tweaked it a little bit, so that way she'd be like, well, he is unable to reach in his back seat and grab something, or saying other things, just kind of like working her way around the fact that everyday living activity things that he can't do, but is very close to baseball-specific movements. So with all that being said, is she basically approaches every case to get the patient the best care they can possibly get, whether it be getting them pain-free, and that's as far as they can get, but it's the best they can get, or working her hardest to get them back to where they truly can be functional in what they want to do before they had their injury. And my next question kind of segued off of that one, being how does she approach her progression for concussion patients? So we talked about that there are kind of two main factors in what causes lack of balance in concussion patients. There's the visual tracking, where if there's something kind of like constantly moving in front of them, or there's not really a point where their body can fix on, they can kind of lose their point in space. Also, the very fast rotation of the head, and my question was whether the visual tracking of the eyes is what causes them to lose their balance, or if it was the actual movement of the head that causes the lack of balance. And it's a combination of both. With that being said, the way she progresses her patients in getting their balance back is she kind of like starts them like very simple. Balance. I mean, we talked about this in class, but very balanced. She's very good about adding different levels of difficulty to skewing their balance. So she starts off 2-foot balance, basic like that. Then progresses to air X pad. Then has them walking while balancing, walking natural gait. And then progresses to them having to like catch or move their head side to side while walking. A little side to side motion while forward to get the visual tracking going. And then she has them tracking actual objects instead of just moving their head side to side. So it's either A, they're moving their head side to side while looking still at the thing, or they're actually moving their eyes while not moving their head to get more ocular motor skills getting going. So it's basically the stacking of levels of difficulty on to see how far their cognitive recovery has progressed that she kind of addresses her concussion patients as. And those were the two main, well, I guess that's kind of a lot of things, but those were the two main things that we talked about during our time there. and kind of what I got based off that for concussion recovery. Just to maybe just a slow progression of allowing their sensory system to take one more thing at a time. If they can handle this, then okay, throw them this. If they can handle this, throw them this, and so on and so forth.